Hi, my name is Mandy Kinneb. I am a student PT at the University of St. Augustine, and today I'm talking about social determinants of health and how they affect Parkinson's disease. So, there are six social determinants of health from the Kaiser Family Foundation. There's economic stability, which is income, employment, housing security. Do they have a good work environment? Anything related to that? Education, so that could include a health literacy, what other learning opportunities they have, the healthcare system. Do they have access to care? Is it easy for them to get to a doctor near them? And are there lots of options for different providers? And the neighborhood and physical environment is, do they have good housing? Do they have a safe way to get places? So, good transportation. Do they feel safe where they are living? Then, community and social context can be the relationships, the support they have around them, different church groups, teams, clubs they might be a part of. And discrimination can also play a part in that. And then food, so access to affordable food. Is there healthy options that are easily accessible in grocery stores near them? Then why do social determinants of health matter in Parkinson's? So Parkinson's is a neurological condition that often can be hard to diagnose if they don't have access to treatment options or even just a doctor in general. So it can also influence our diagnosis, treatment access, and long-term function. So I'm going to focus on economic stability, neighborhood environment, and community and social context. So economic stability affects Parkinson's just because medication and treatment are really expensive. So that can cause a really big financial strain. And if they already cannot afford it, that can lead to even more problems. So lower income can also lead to a delayed diagnosis. Unstable finances lead to reduced medication adherence, and less access to neurologists and advanced therapies can really make an impact on their whole treatment. So economic and even financial stability in general can play a really big part on whether those with Parkinson's are receiving the treatment they need. So the neighborhood and physical environment can lead to a unsafe or limited walking areas, which is harder to stay active, which can have a big play in Parkinson's disease and how fast they might decline. Then transportation barriers can lead to missed appointments, and distance of care can lead to fewer visits with any doctor or even physical therapy. So social community context, Parkinson's can be really impacted if you don't have a support group around you. So, a lower socioeconomic status is linked with greater community disadvantages, a low support and medication non adherence, and then communities with fewer medical resources can create unequal access to care. So, they really need a good support around them with lots of opportunities and resources so they can make the best out of the situation they're in and also receive the help that they might need. So, social determinants of health matter in PT because it can help identify barriers beyond just symptoms. We really treat who they are and not just what's showing up right in front of us. So, getting to really dive deep into who they are as a person and what might be affecting them at home versus what's just on the surface level in front of you. It can also lead to a more personalized, realistic treatment plan and improve adherence, safety, and quality of life because you're really getting to know that entire person. If they see that you understand what's going on with them, there's a lot more likelihood that they're gonna buy in and do what you're asking of them. And then you can also support them as a whole person and really give them the care that they deserve because they might not have received it anywhere else. And here are my sources.